Brooklyn Independent Television.
Welcome to Healthbeat Brooklyn on Brooklyn Independent Television. I'm Dr. Monica Sweeney. In the fight against cancer, we have a long way to go, but great strides are being made, and some of that is due to an increase in cancer screenings. Healthbeat's Nia Ham looks at two programs aimed at making screening available to people without health insurance. One is hospital-based, the other has wheels. But like most of their patients, both are hurting from the recession.
Higher unemployment and a lack of affordable health insurance are forcing more people to seek free cancer screenings. Services like the Project Renewals Scan van, which provides free screenings to uninsured residents throughout the city, including Brooklyn, are crucial in times like these.
When they have the mammogram, normally after 1 week or 2 weeks, they do have the report. Any problem, they call them before the 2 weeks. So they send the patients to different hospitals or clinic or to their own doctor. We do screen patients with insurance, we not our insurance also. Any race, any colors, whatever, Everybody, we screen everybody.
But as shown in a study by the American Cancer Society, more communities like Brooklyn are seeing cutbacks to free screening services like mammographies. The scan van has served fewer women this year because of an $8 million budget cut to New York's Cancer Services program. Still, the van serves a huge need in the community. Project organizers say they will continue the fight for funding.
There's one lady who just told me today that this was the van that had saved her life. She had this test done 10 years ago in a van, and if they caught it before the first stages or about that time, and she's here and working with us in our community.
When I was out of work, I had really no other means of getting this done, and this was totally free, and I felt it was important, so I followed it up.
Despite new guidelines recommending women begin screening later in life and get screened less frequently, many patients say they will continue to get yearly exams.
Yes, because most of the doctors recommend that when you reach a certain age that you start getting screened. And most of all the people I know, they take advantage of that because, like it said, early detection saves life.
And I will tell you that a recent study that I just saw had actually asked medical doctors who actually order the first screening test, and a lot of them, about 70%, still said that they would not change their practice. So again, I think it should be individualized. Each patient should have a very important talk with their medical doctor, and from there they can decide what is the best screening for the individual. Was that we weren't able to show that
Dr. Audrey Saita, Senior Vice President and Chair of Radiation Oncology at Lutheran Medical Center, say the hospital also offers free screening programs.
Lutheran Medical Center does offer free screenings. We do have in the clinics and at scheduled times during the months, like let's say October is Breast Cancer Awareness Month, we do offer free mammogram screenings as well as prostate screenings. So I think it's important for the individuals to look into their communities and their local hospitals that do offer these. I think that it is a hot topic right now with healthcare reform and the way everything is changing, that people are trying to take more advantage of these programs, and education is definitely out there a little bit more. We have lasers here that's set up to exactly where we would need to treat, and then we would rotate the gantry to where we want it to go, and then we would point that. No, it's directly to the body, and it's directly to the area that's needed. So if it's a breast cancer patient,
besides getting screened, Dr. Saida says there are other ways people can prevent cancer throughout the year.
Diet is very important, not just for cancer reasons, but for health reasons and heart reasons. Exercise also has been shown to be very important, again, not only in the cancer world, but in the heart disease world and other illnesses that can develop from it. So diet, exercise, and following up with a medical doctor for their screenings at their time. are all things that can be done by a patient. Cancer specifically.
For Healthbeat Brooklyn, I'm Nia Ham.
Brooklyn Independent Television on the BCAT TV network.